Hey guys, Cam here. Today I thought I'd actually take you in the treatment room with me and see what it is that I do with clients. So in this video you get to see me sit down and do a consult with someone, go into an assessment, mobilizations, and then the tissue treatment, and we'll have a look at the before and after photos. Check it out. Ben came to see me in the Camberwell office as he had some ongoing shoulder pain from his job. Being a furniture maker, he works with factory tools quite a lot, and so he had some repetitious injuries he was looking to get sorted. It's very important in the consult that we first look at injuries that he's had in the past and assess him from there. I also looked at vital functions, as you see me doing with the eyes here. That's a little bit outside of today's video, but perhaps I'll do a video on that another time. But the vital systems can influence the body in different ways, including the eyes. Here you see in a photo that we're looking at Ben's arm raise. I should have had him take his shirt off so we can just see it in this before photo, but if you can look closely, you'll notice that his shoulder blade on both his left and right side, particularly on the right, was quite stuck. He had limited thoracic extension, and he also was unable to get his wrists above his shoulders for 180 degrees of shoulder flexion. So first we work on the thoracic spine because we always work proximal to distal. So we've got him on the roller here, just trying to soften up the spine a little bit and getting him to breathe into his chest, open up through his thoracic spine. And I'm also checking his respiration because breathing can influence the body quite a lot as well, and the spinal position it will take. Here we're just doing some gentle rotations just to help with mobilizations. We also did some extension work before moving on to his shoulder blade. Now the scapula often gets overlooked in a lot of treatments, so here we want it to be able to retract, depress, and go into posterior tilt. So here you see me doing a mob. Even just doing these first two things alone can improve a lot of issues. Now I'm just doing a little bit of posterior capsule work and a bit of inferior capsule work just to help open things up even further. Then we move on to the tissue treatment. Now I have to say that, as you can see, there's a little bit of redness coming up on his shoulder. This is perfectly normal, and for some people it can be kind of shocking to see that, but we have normalized in our culture cupping that you see in Chinese medicine. This is actually very similar to that. It does bring a lot of redness to the skin, but this actually creates a lot of benefits to the muscle by flushing out a lot of old adhesions, fibrotic tissue, and old upset tissue from injuries. Now when we look at his arm raise test, you can actually see his whole face because he's now able to get that 180 degrees and also able to get more posterior tilt and upward rotation on his shoulder blades. So we've created a lot more space. But don't let me do all the talking. Here's a testimonial from the man himself, Ben Watts.
I wanted to shoot a testimonial for Cam to just say thank you, dude. I mean, I work a physical job. I'm constantly using this left arm over the top, you know, constantly like this. One session, man. One session. And basically, I've probably spent $1,200, dude. I told you this. Like, more on going to the osteo, and you know, we had a management plan and it worked, but like one session with the massage and gone, dude, gone. Like, doesn't exist. It's profound. It really is. It's crazy work. I appreciate it. I'm coming back. 5-star, 10-star, many stars. Do it. Sign up, lock in, get your body fixed.
Hey guys, if you're still here, thank you for staying tuned to the video. That's a little preview of what I do. I absolutely love helping people like Ben get back into their lives to do what they love to do, pain-free and feeling better in their bodies. So if you're someone who's been jumping around from practitioner to practitioner and you're not really finding clarity around your injuries and you want some further troubleshooting with a skilled pair of eyes and hands, then slip on into my DMs, go to my website, mindmovementmastery.com.au. Leave a comment, engage. So thank you guys. There are going to be more videos like this in future. I'm going to do a follow-up with Ben as well and go into the strengthening and programming aspect of what we should be doing with his issues, because it's all well and good to do a treatment, but what really helps these things stick is the strength training that you do thereafter. That is really up to the client or up to the person to go away and do for themselves. So stay tuned for that one. In the meantime, stay happy and well, get outside, play, move, and feel better in your bodies. Thanks.